appreciate the opportunity to speak with those of you on the phone, and applaud you for your vision and hosting such a forum where people can share ideas and next practices to further advance this great work. I hope today to share with you some of my journey, as Sam said, and then perhaps finish a bit early so that at the end we can engage in a dialogue via the web here and answer questions or have you share input from your organization so that others might learn from this opportunity. But as Sam said, I have been on this journey for many years, a bit over 15 years. I have had a passion for trying to help organizations optimize the patient and employee experience. My path in medicine was altered by a couple of mentors in my life that have shaped what I do today. And one of those individuals was Earl Bakken, who I met in the last month of my training in my residency at the University of Minnesota Medical School. And in my last month of my training, I came home at the end of the day and read a paper that he had written 50 years ago called The Healthcare System of the Future. And he had a vision. He's an engineer, so he thinks in systems or circuits. And in this paper, he talked about treating the patient as a whole and complete human being, not diseased and fragmented body parts. So this really resonated with me that day after a patient I had seen in the ICU that morning. So as in my sleep-deprived state, I picked up the phone, called information. It said he'd gone to retire to Hawaii, and dialed 411 and actually ended up speaking with him. And I said, hi, Mr. Bakken, my name is Dr. Duffy. I would be interested in working with you. He had a dream and a vision to build a hospital that would be the most healing hospital in America. Well, he started to laugh and he said, I've only come here to retire and sit in a hammock, which lasted all of 2 weeks. And that hospital vision has been open and running and built on the Big Island for a little less than 15 years now. But I'll share with you how he influenced my journey and my current work, because we started on this path when it was not very popular, when people thought this was just fluff, and when the government didn't really care and wasn't asking anybody to measure patient satisfaction. But one thing he said to me, which has influenced what I want to talk with you about today, is at the end of the call, he said to me, he said, Bridget, as you start your career, you need to remember one thing, that only 20% of healing is linked to the technology I helped invent. And he invented the pacemaker, and he founded Medtronic. And he said it's the other 80% where you need to spend your time and energy. And I said, what is the other 80%? And he said it's three things. It's the human-to-human interactions and relationships that people need and value most in healthcare and can impact outcomes. 2, it's the physical environment. The space matters. And 3, he said, it's spirituality. He said, I don't care what your religion is, but he said, when people are ill, we strip away the things that matter most to them, and often it is around spirituality. We need to put those things back in. So that those words have really stuck with me as I launched my career as a physician, and my path and my passion for helping organizations optimize and humanize the patient and the employee experience. So I would like to share with you today my experience over the last 15 years in doing this work with many, many organizations. I rarely embed in one organization, but I did spend some time while still living here in the Bay Area in San Francisco, where I live. I spent 2.5 years commuting to the Cleveland Clinic, where I served as the Chief Experience Officer to lead some work there. But I'll share with you my experience in that organization as well as many, many others that I have worked with over the past many years around this work. The one thing that I want to share in really opening up the dialogue today is that I think the only true way to create customer loyalty and market differentiation is for us to focus on the human experience of care, and that the really great innovation will come from thinking about that. And I feel very, very strongly that that this work is not about customer service. I think there are components of service from other industry that we can learn from in healthcare and can adopt, but that is not enough to truly make improvements and set us apart. I think healthcare is unique. I think we meet people when they're most vulnerable. facing great fear, anxiety, facing their mortality, and that things like just service issues around warm food and apples in a basket in the emergency room and nice art features and scripting our frontline employees, those are all good, but they're not enough. And so the work that I have done with my team over the last many years is about restoring the human experience to care and finding and mapping the gaps in that human experience and putting those things back in. So that is the work that I do through ExperiaHealth, and we like to serve as a catalyst to support others in doing this work. It complements the work that many organizations are doing around service recovery, customer service work, from scripting their frontline employees and training. But we have a unique approach that really, I think, differs from all others. And it starts with first engaging at the top level with the CEO. If the CEO hasn't made this a top strategic priority, we don't waste our time. Number two, it's identifying physician leaders that lead this in partnership with nurses. And three, it's linking it and integrating it to quality, safety, and performance improvement work. And then it's the core, which I'd like to share today, is around mapping the gaps in the human experience of care and finding the always events or the things that we can put back in that truly enhance the human experience of care and create customer loyalty. So that's the real innovation that I want to talk about with you today, that Sam asked me to speak about and share that with you. So my hope for today is that I can shed some light on, and perhaps many of you already know this and are doing work in this area and can share that on this call, but is what are the components of an optimal or an ideal patient experience? And by the way, they're way beyond just chasing HCAHPS scores and trying to improve the numbers. Number two, what are the components of an optimal staff experience? When I first started at the Cleveland Clinic as the Chief Experience Officer, I spent 2 months in scrubs just walking in the shoes of every employee. And I came back to the executive team and to the board of directors, and I said, I cannot focus on the patient experience until you first focus on optimizing the employee experience. So we spent a lot of time in strategy and building infrastructure and in partnership with Human Resources Department in figuring out what it would take to have employees not feel like they had to check their soul at the door when they showed up every day, because they are the key. If there was one thing and $1 I'd put anywhere, it would be to create and optimize the employee experience and create a place where people want to spend the rest of their career as the key driver to improving patient experience. So I'll share a little bit about that. Three, then, from this process, there are ways to identify what the Picker Institute calls always events versus never events that will differentiate your organization. We focus on never events in this country and cost reduction, but we don't often talk about the things that we need to put back in. So I'd like to share a couple of innovations around that. And then lastly, how do you get your organization aligned to deliver these improved results? And how do you have your organization focus on this as a top strategic priority? So that's an outline of really the roadmap I'd like to take us on today, and then really perhaps have a chance to learn from you. So given this and all that we know that's going on in healthcare today, and by the way, I feel pretty strongly, shame on us that we waited till the government mandated that we actually measure customer service. We should have taken the lead on this, but for whatever the reason, there's a lot of interest and attraction in this work in the last 5 years, more so in the last 2 to 3, as you know, because the government is tying reimbursement to the data, to your scores, in addition to your quality scores. I probably get a call or an email per week from a recruiter asking to help them write a job description for a Chief Experience Officer and asking me if I know any that could fill a slot that they're looking for. We have launched at ExperiaHealth, one arm of our business. We help do on-site consulting, but the other arm was really pushed by several of these physicians. I've now found about 20 physicians in the nation who have the title of Chief of Quality and Experience. I've helped about a third of them write their job description, and several of them said, Bridget, why don't you create a network of us where you bring us together to help share ideas and help create a research agenda around actually measuring what matters most. So we've launched at ExperiaHealth a Patient Experience Collaborative, which is, I view as a seed incubator for spawning and sharing ideas around real innovation, around optimizing the patient and the employee experience, and then collaborating on actually measuring this and showing the ROI so that this can become sustainable and scalable within healthcare today.